Qi and body fluids, blood and body fluids, its relationship. Actions of Qi on body fluids. The action of Qi on body fluids are quite similar to those of Qi on blood. Promoting fluid production. The movement of Qi provides the generative power for the production of fluids. Body fluids derive from essential Qi of drink and food transformed by the spleen and the stomach. Their formation and distribution are closely related to the spleen, the stomach, and the small intestines. If Qi of the involved Zangfu viscera is plentiful, body fluids will be plentiful. Conversely, they will be insufficient. Powering fluid movement. The distribution and excretion of body fluids depend on Qi movements of ascending, descending, exiting, and entering. The metabolism and distribution of body fluids and the excretion of sweat and urine are all depend upon the coordinated actions of the lung, the spleen, the kidney, and the organs. If Qi moves so body fluids, if the ascending, descending, entering, or exiting of Qi is impeded, then the distribution or excretion of fluids is also disturbed. This may lead to water retention, phlegm accumulation, or dampness obstruction that can result from the stagnation of water. Stabilizing fluid movement. Qi regulates and controls the movement and excretion of fluids and prevents their excessive loss. For example, defensive Qi controls the opening and closing of pores and helps to prevent damage to body fluids from excessive sweating. Kidney Qi causes the fluid stored in the bladder to be transformed by metabolism into urine and its discharge. Deficiency of Qi can lead to spontaneous sweating. Deficiency of kidney Qi can lead to frequent urination, polyuria, and enuresis and incontinence of urine. Actions of body fluids on Qi. Like blood, body fluids are a carrier for Qi, and Qi must be attached to fluid or blood to act. If body fluids are depleted, for example, by diaphoresis, polyuria, vomiting, or diarrhea, Qi loses this attachment and may scatter. This gives rise to Qi collapse following heavy loss of body fluid. The relationship between blood and body fluid. Both blood and body fluid belong to yin, and both act to nourish and moisten. They supplement each other in physiology and affect each other in pathology. Since they both derive from the essence of drink and food, body fluid and blood share the same source. When infused into a blood vessel, body fluid becomes a component of blood. Some components of blood may also seep out of the vessels and become part of the body fluids. Under abnormal conditions, when there is massive loss of blood, body fluid enters the vessels to make up for the volume of blood. This in turn leads to insufficiency of body fluid and such symptoms as thirst, oliguria, and dehydrated skin. Conversely, if there is a massive loss of blood fluid, some components of blood can come out of the vessel, resulting in insufficiency of blood. The internal classic states, those who have lost much blood do not sweat. Those who have sweated profusely lack blood. This is the practical application in clinical practice of the theory that body fluid and blood share the same source. Thank you for your attention.